Hi everybody, my name is Dr. Stanley and I'll be walking us through the dRPC experience, how the dRPC use pause and reflect to learn and improve. The dRPC is the intermediary anchoring the implementation of the Partnership for Advocacy in Child and Family Health at Scale, otherwise known as PaCFaH project. The PaCFaH project is a health accountability project which aims to strengthen the capacity of indigenous civil society organizations at national and state level to hold decision makers in the executive and legislature to account on effective child and family health delivery. The project has 4 key issue areas, including family planning, routine immunization, childhood killer diseases, and primary health care under one roof. Currently, the project is being implemented by partners in Kano, Kaduna, Niger, Lagos, while for the TSTS component of family planning, this is being implemented in Taraba, Anambra, and Enugu states. The dRPC and the COF decided to embed the responsive feedback mechanism to explore how dRPC and the Kano PaCFaH coalition might iterate and optimize their activities while the program was live in the field. Following introductions and training sessions, the Kano PaCFaH coalition were tasked to institute the responsive feedback mechanisms in their advocacy work. The dRPC and the COF ran testings on the theory of change below. We felt that open communications between coalition members would lead to better cooperation of coalition partners, and this will in turn lead to stronger coalition of committed civil society organizations, all advocating for timely allocation and releases of funds. We also felt that greater visibility of intermediary interactions would increase frequency and quality of advocacy meetings with a more diverse range of targets, and this will in turn lead to stronger partnership between civil society organizations and champions in the government, resulting in healthy family and child policies implemented. Now we'll take a look at how we run a productive pause and reflect session at the dRPC. Pause and reflect sessions were integrated into post-advocacy meetings to allow for reflections and discussions about the experiences of the coalition post-engagement with policymakers on the need to prioritize health financing. Work planning also mandatorily included pause and reflect session, making it a habit for the civil society organizations. The learnings from all pause and reflect sessions were made important sections of the coalition's activity report, which then informed recommendations on next steps. It was important that a skillful facilitator outside the coalition be tasked with coordinating the pause and reflect sessions and collating all the responses. This increased openness and eliminated suspicion of competition whilst sharing. Coalition members were provided a safe space to either speak freely without prejudice during sessions or make submissions to encourage open communication. Following the integration of pause and reflect sessions, the learnings from experience sharing during pause and reflect sessions aided the Kano PaCFaH coalitions to better strategize on how to leverage on intermediaries in their effort to secure advocacy opportunities with key advocacy targets. Another example of how we use pause and reflect session was following a past Kano coalition's advocacy visit to the Kano State House of Assembly, where a press release was made by the press secretary misquoting the advocacy lead. This innocuous press release was then picked up by an online media outlet that reported the story as "Group Attacks Kano State Government for Withholding Funds." This was identified during the post-advocacy pause and reflect session that same day, and the PaCFaH coalition quickly moved to mitigate the potential damaging story by reaching out to the press secretary of the Kano State House of Assembly to retract, rectify, and clarify the press statement. Following this, the PaCFaH partners moved to get the media outlet to retract and republish accurate events. Then PaCFaH partners also got other media partners to tell our own side of the story. Pause and reflect sessions help to immediately identify and address negative media issues regarding PaCFaH coalition activities. The Kano PaCFaH coalition conducted an evaluation of the integration of pause and reflect sessions, and some of the learnings are highlighted below. The CSOs overwhelmingly agreed that they had gained new skills and capacity gains following the introduction of responsive feedback mechanisms. When we asked how it affected the pace and speed in which the organizations planned and carried out work together, the response was overwhelmingly in the affirmative. The frequency of meetings were now more increased than usual. On the ability to effectively deliver advocacy messages to targets, they all agreed that there was improved coordination, there was improved collaboration. Qualitatively, we learned that communication was now more effective within the coalition, with members now more open to sharing information about emerging issues and possible intermediary links to advocacy targets. Since integrating the pause and reflect sessions, collaboration amongst coalition partners have improved. Pause and reflect sessions of the coalition's post-advocacy interactions have improved their skills as they now routinely reflect and discuss their performance together. We have also learned that if the coalition members see the RFM pause and reflect process as a medium for learning, sharing of information, and widening their horizon on how the advocacy is to be approached, then they are more likely to adopt the process. From the learnings of the Kano PaS Coalition, we are now scaling up to the PaS Kaduna Coalition. An initial baseline was conducted to measure the level of effectiveness of Kaduna CSO Coalition's inter-CSO collaboration to implement activities towards a common outcome, measure their effectiveness in reaching policy targets and communicating advocacy messages, as well as perceive potential benefits of the pause and reflect sessions. Some of the learnings are highlighted below. Regarding effectiveness of the CSO coalitions working together, 60% agreed that they were not very effective. Regarding the effectiveness of the CSO coalitions in reaching policy targets, we had mixed levels of effectiveness. When we asked of the potential benefits of NGO members following integration of pause and reflect sessions, 26% saw this as an avenue for improved collaboration. 11% saw this as an avenue for conflict resolution. 26% saw this as an avenue to improve the ability to reach policy targets, while 37% saw this as an opportunity to increase capacity to work together. The dRPC PaS evaluation of the pause and reflect sessions has evidenced improved coordination, collaboration, and effectiveness of the Kano PaS Coalition. The baseline findings from the Kaduna PaS Coalition also provides an opportunity for integration of the pause and reflect sessions to improve the dynamics of the coalition, hence its proposed scale-up. At the dRPC, we're keen to sustain and continue pause and reflect sessions throughout the implementation of the project. Thank you very much for listening to this presentation.